Hello all, this is Dr. Shilpi Reddy and we're talking today about the new COVID virus that is again trying to come back into our lives. It's been 3 years and we're still struggling with COVID. Yes, and this time it is coming up in a new form. Whether it is going to come to India, whether we're going to have another wave, or all these things are very high speculations. But there is a new variant that is coming up, and the virulence of this variant is quite high, and it has already started in China. And what has to be done in our country and the next future couple of months is something that we should be taking care of. Since this month is about festivals, about New Year, about gatherings, about Sankranti, and coming up little more holidays and together and get-togethers, it is very, very important for pregnant women to take care of themselves. I still say, on my personal ground, since being an obstetrician, that pregnant women should take care of themselves. They should avoid group get-togethers and group places where there are a lot of people, and they should be following their hand sanitization techniques. They should wear a mask, and the social distancing aspect should be there. And wherever possible, please stop traveling, especially traveling out stations and traveling outside countries, and flight travels and train travels where there are a large number of people traveling together. And now when it comes to the new COVID variant that has come up in China and that is spreading currently as another wave, it has virulence, and this COVID virus is not the similar kind of a virus that we've seen in the past. Rather than the respiratory symptoms, we are having a lot more other symptoms like body pains and fevers, and a lot of malaise and weakness and all that. And it is also having joint pains, and it is having an impact on the muscles and bones as well. So every COVID variant typically presents differently, and every COVID variant changes its form so that its survival is important for it. So now this season again, this wave again, COVID is coming back with different kind of symptoms. But for pregnant women out there, their care is very, very important, and anyone who has a pregnant woman in their family, they should also be taking care of themselves, like avoiding crowded places, and avoiding travel, and taking care of their hand sanitization methods, taking care by wearing a mask properly. And the most important thing is vaccination. Vaccination is an integral part of the COVID program that everybody is running. And if you've finished your 6 months from the last booster vaccine that you've taken, please do take a vaccine again. The booster shot is very, very important. It also applies for pregnant women. It also applies for women who are planning pregnancy, first, second and third trimester, and also for women who are breastfeeding their children. So COVID booster vaccine is something that is going to protect you against severe COVID. So it doesn't mean that the COVID vaccine that you've taken is going to protect you from infection. At times you can have infection, but the severity is going to be very, very less. So COVID vaccine out there is available near your house, anywhere nearby your house. Please go there and get the vaccination done as soon as possible. And in terms of taking care, it is very important that you do not neglect the common cold and flu that everybody is getting from the last 2 months. Now, other than COVID, also we have seasonal flu that has been hitting everybody around us. So this seasonal flu also can be COVID, and so it is very important that you should not be taking over-the-counter prescriptions like anti-allergic medications, cold medications, fever medications randomly, antibiotics randomly. Please go to the doctor and do take medication from a certified authentic doctor, a general physician or a pulmonologist if you are having severe cough. So this actually keeps you away from a lot of complications that can develop on irregular medication use. So whenever possible, since we are in India, we have access to doctors, and we can travel and book doctor at any given point in time and go have a proper consultation. Please do have a proper consultation when you have cold, cough, fever, headache, nausea, vomiting, cramps, abdominal pains, body pains, and headaches, and all these things. These can be anything but flu. It can be COVID also. So it is very, very important that you go to a doctor, a certified doctor, and get yourself checked. And another very, very important thing is, if anybody in the house is having cold, cough, flu, and flu-like symptoms, it is also important that they should be taking care of themselves, and they should be wearing a mask and a little bit of isolation from others, so that the others in the house do not get it as a form of an infection, because it is droplet based and it is airborne. So even in the family members can get, and especially in the office everybody else can get, especially if the child is going to school, they can get it from school also. And pregnant women are supposed to be very, very careful about these kind of things. And for pregnant women out there, there is a flu vaccine that is available, and you can also take the annual flu vaccine to prevent yourself from the annual cold, cough, flus that can also have a severe form. So the influenza virus can be as mild as a simple cold with a running nose and a cough, and as severe as pneumonia and lung damage, and it can go to ICU admissions also. So to prevent yourself from these kind of infections, you always have an option of vaccination that you can adapt to. Like what COVID vaccination is, that there is a flu vaccination schedule also, which is done annually, and you can take your annual flu shots to prevent yourself from all these things. But the basic is to prevent and to avoid and to increase your immunity. Have food on time, have organic food, exercise on time, have good sleep routines, and take your vitamins if you're deficient in, and make sure your stress is at bay. So all these things help you a lot and your future secure. So this is about COVID and how to protect yourself from COVID. If you've liked my video, do share and subscribe, and do follow me on my channel.